one of the reasons we want patients to come and see us on a regular basis, even after a long time after bariatric surgery, is because we want to help them when this happens. The reason I find that patients actually struggle with weight regain in the long term, Kemal, is when something happens in their life that disrupts their focus. Typically, this could be, for instance, something happened, in their personal life, whether there was a divorce, losing a job, losing a loved one, that really makes them emotionally very, very stressed out. They lose focus, and then obviously they could gravitate towards utilizing food as a way to cope with that, right? And people may ask, but if they have a small stomach, if you've done surgery on them, how can they regain weight? How would they be able to eat and regain weight, even if they are really struggling emotionally? Well, the truth is, Kemal, is that even when you have a small stomach after a sleeve gastrectomy or after gastric bypass, if you eat continuously with high frequencies through the day, very high calorie content foods, obviously you are going to accumulate enough calories that the body will start storing energy, and then the weight could eventually come back. When people are in these situations, we want them to reach out to us, right? To make sure they come to us. And I understand very often patients shy away from doing that because they feel some kind of, they are almost ashamed to come back to us and say, look, I haven't succeeded with the tool that you've given me. But we're not here to judge, we're here to help. We want patients to reach out to us at the time in which they are the most vulnerable. We are their home. We are the ones who can really provide the resources, the support that will allow them to refocus again, right? So struggling can happen. It can happen 2 years after surgery. It can happen 7 years after surgery, particularly, as I said, if an event happens in their life that really gets their focus away. But we want them to really reach out to us, and we have the resources to do that. There's a, they can reach out and talk to their surgeon. We'll be able to get them together with their nutritionist. And then, of course, there are more resources nowadays. We can put them in programs, including weight loss medications that could be a wonderful adjunct for people who are struggling, in the long term.
Absolutely. So, the other issue is with can we actually talk about the portion control? And I do want to make a reference to the Robart products. I have a couple of them with me, but this is one of the bars that we have. And this one is the beverage, and this is the pudding. So like if you were to kind of like look at them now why are they in my office? Because I use them. So for meal replacement.
By example, right?
Well, in many cases, trying. Yeah. So, but we use Robart new direction products prior to surgery, especially in that for the 2 weeks pre-surgery. Do you recommend them to maybe do like a meal replacement with one of these products post-surgery?
Absolutely, absolutely. I think there is a place for that. It's not for everyone, of course, depending on their circumstances. But for instance, in the long term, utilizing one of these products as a way to go through the day, for instance, or to curb that hunger, or to curb that need to munch on something, right? It's a good way to do that. Why? Well, first of all, these are products that are full in their nutritional content. They will have all the important nutrients that one needs. Secondly, the caloric content is well restricted and controlled. And for the vast majority of patients, these are actually fairly filling after people eat them, particularly people who've had bariatric surgery, because obviously there is not much capacity within the stomach. They will feel full very quickly. Now, the good thing is they come in different flavors and also different preparations, as you showed them right now, whether it's a bar that you can eat, whether it's a shake that you can drink, or a pudding that you can eat, which is kind of semi-solid. They come in different varieties, and one can make them almost like a replacement of a meal during the day, particularly for people who struggle with needing to have something in the middle of the day. So that's one way of utilizing it. Another way, which I think is a good way of utilizing this meal replacement diet is for people who, for instance, are struggling, for instance, to maintain that weight loss, or who want to really go beyond a certain level and they are hitting a plateau, in their weight loss journey. I put them on a new direction diet for a couple of weeks, Kemal, for two reasons. One is, once you are on that new direction Robert diet for a couple of weeks and you're not eating anything else but the Robert diet, that takes the stimuli away, right? Stimulus avoidance, so to speak, right? Because when you are eating normal things, you are in the middle of the day or in the evening, and then you've got a choice. Shall I eat this? Shall I eat that? How about this, right? That by itself is very distracting in terms of really staying disciplined, right? Now, when you are on this diet, you don't have any choice. That is what you're going to have. There is no really stimuli that you have to be worried about. And that can break the cycle. That can break that habit that you are into if you do this for a couple of weeks. And then obviously you can refocus again after you've completed this. Another important use of the new direction diet, Kemal, is that it can give a person a jump start in terms of their weight loss, right? So if they feel stuck, for instance, they cannot be beyond a certain weight, well, they go onto that diet, they may lose 10 pounds, 12 pounds, and that jump start actually is a huge boost from a moral point of view per person to stay motivated and continue in their weight loss. So it's not uncommon for me to recommend the new direction Robert diet even a long time after bariatric surgery for a variety of reasons. So you are absolutely right. It is very useful. As I said, it's not for everyone, but for the right person, actually, it can work very well. The weight problem is happening not because of too much vitamins or micronutrients. The weight problem is happening because we're eating too much carbohydrate and too much fat and maybe too much protein as well, right? So we want to reduce that bulk. We want to reduce it. And that part of what bariatric surgery does is at the end of the day, you end up eating much less quantity of overall food, right? Now, if the food that you're eating is, let's say, 1/3 or 1/4 of what you used to eat before surgery, then by definition, whatever amount of vitamin or micronutrients you had in that food is going to be reduced by that amount as well, right? But because the vitamins and micronutrients are so small, any reduction of their amount is going to have an impact on it, right?
Exactly.
Great. Which, to your point, essentially, just by reducing the amount of food you're eating, you're already putting yourself in a situation where you could be lacking micronutrients. So intuitively, you do need additional supplementation to make up for that lack of micronutrients that reducing the amount of food is putting you through, right? But on top of that, particularly for procedures like gastric bypass or the switch, on top of reducing the amount of total food that you're eating, we're actually reducing the amount of available surface on your intestine to actually absorb and take in as much as possible from whatever you're eating, right? Because you're rerouting the intestine. So there are many steps now that are affecting your ability to have enough micronutrients, enough vitamins, and enough minerals. For this reason, after bariatric surgery, you cannot have this nonchalant attitude about vitamins. Shall I take it or shall I? You have to take vitamin. It is very important. And in certain cases, not taking those vitamins could have some very serious side effects in the long term, whether it's bone weakness, whether it's decreased immunity, whether it is thinning of your hair, whether it's inability to heal well if you have an injury or you have surgery, or whether it's even problems with the nervous system, whether it's memory loss or difficulty walking. Those things can happen with certain if certain vitamins are lacking over a prolonged period of time. So this is a very serious and important part of education in bariatric surgery. And of course, it makes up a very large amount of time we spend before surgery to educate our patients. Now, because our patients will have the change in the surgery at one time, but then obviously they have very long life after that, it is critical that they are patients for life with a practice like ours, so that we can follow them over the years by doing blood tests and making sure we focus on the appropriate vitamins also when we assess them on follow-up. So, patients maybe 2, 3, 4, 10 years after surgery may forget what we taught them. But if they are not following with us on a regular basis, we would not be able to reinforce the importance of these things as they go forward. So, taking the vitamins on a regular basis after bariatric surgery, and also having periodic tests to make sure that the levels of those nutrients are adequate is a critical part of being a healthy bariatric patient.
So I guess just to kind of maybe help our patients to process this in a different way, or maybe the more effective way, what we are saying is, going through the surgery, losing weight is definitely the greatest benefit. Unrelated to this, vitamin deficiency is a different type of a problem. So, but because of the intake is going to be low and you're going to eat less, you are not going to be prepared, or you are a better target for vitamin deficiency because you are not eating as much as you did before. So the supplements are definitely a must.
Absolutely. Absolutely. It's very interesting that you bring out this point, because I saw a patient on consultation today, and, when we were discussing about questions she had about, this was a patient who was looking at the gastric sleeve. And when we were talking about, questions she may have, she said, "Oh, I heard that you have to be on a pill for life after bariatric surgery." And I was explaining to her saying, well, there are certain medications that we want you to take for a few months after surgery. For instance, if your gallbladder is still there, we want you to take a medication to reduce the chance of gallstones. And then we want you to take an anti-acid medication, but also for 6 months. But then after that, the only medication we want you to take is actually a multivitamin and perhaps calcium and vitamin D. And then she said, "Oh, no, I was not thinking about multivitamin. That is definitely, I don't even think of that as medication." And she was thinking perhaps of some other medication. But really, if you have bariatric surgery, you have to know you also have to take multivitamins for the rest of your life. Now, the argument that I would make is that this should not be anything different from a person who has not had bariatric surgery. The only difference will be the quantity of multivitamins will be higher. So, for instance, generally, a person who's had bariatric surgery, we would want them to take double the amount of, minerals and vitamins that would be categorized as daily requirements for somebody who has not that bariatric surgery. But then on top of that, particularly for some procedures like gastric bypass or duodenal, which there are certain vitamins that really they must have in large quantity. For instance, vitamin B12. B12 is a very important vitamin that if we cut the stomach and reroute the intestine, we could really be short of, right? And which means people must take that. And because it is so important, and sometimes people really don't feel they can be very compliant if they were just to take it as a tablet, very often we recommend that B12 is actually taken as a monthly injection, Kemal, just because in that way, then we will know. Right. So, you're not a bariatric patient, but you like to make sure you have adequate B12, right?
Yeah, I told you this before. Justin Timberlake is doing it. So
right. So B12 from that point is important. The other ones that are really critically important on top of the multivitamins to talk about is vitamin B1, or thiamine. That is also very important. And it is important because not only, we may be deficient because we're not taking enough of it, but sometimes patients, particularly early after surgery, if they feel nauseous or even if they throw up, they can become very quickly deficient of that vitamin. So one of the things we do, for instance, if people come to the emergency room or to the hospital, is to give them IV fluids, but add vitamins in that IV bag so that we are supplementing them those vitamins as well. The other vitamin that we want them to take is folate. That's also very important. And then I did talk about vitamin D, which is really something that is very, very commonly deficient in many of our patients, even from the get-go before we do bariatric surgery. Now, among the minerals we talk about, of course, iron is a very important one. And for most people, whatever is in the multivitamin may be sufficient, but particularly in women of childbearing age, they may require more iron just because of their monthly periods. They may be losing some iron, which means that their supplementation has to be high. So very often we will see patients who had gastric bypass and they are of childbearing age. They really need to be up to date with their iron levels, because the iron stores may not be quickly repleted just by taking the iron that they find in their multivitamins, and they may need really additional supplementation as well. So checking iron levels is very important. Other minerals we think about include things like zinc, copper, selenium, which again are needed in very small quantities, and the vast majority of people who take multivitamins should not have problem with the levels of these minerals. But if you don't take the multivitamin, then of course you could be faced with that. Someone is passing suddenly, there is suspicion that they may have passed because of harm. Then in those situations, the law is also involved, and it insists on getting a post-mortem examination, which will help them ascertain whether there had been any foul play in the passing of the person. So essentially an autopsy is that type of examination. It's very thorough. It's done by experienced specialists who are pathologists, and their specialty really is examining parts of the body after the person has died to try to figure out what looks normal and what does look abnormal. So in their report, in the report of the pathologist, one very clear cause of death, Kemal, is what they call intestinal ischemia. In other words, part of the intestine, of the digestive system, particularly the longest part of the digestive system, which is the small intestine, had died before the person actually died. So that was really what precipitated the death of the person. When you have ischemia, which means lack of blood supply to the intestine, that leads to a very severe reaction and condition called septic shock that, if it's not treated, anybody will actually die from that condition. So the cause of death is intestinal ischemia. In other words, the intestine did not have blood supply. That's the number one line they have there, right? So the question is, why did that happen? And then importantly, in the discussion we have in our Bariatric Friday, because this issue was raised by many people within the bariatric communities, was this caused by bariatric surgery, right? Is there a cause and effect relationship there? And that's what we want to clarify here. And I think looking at the autopsy report itself helps us to really suggest what may have been the real cause of the intestinal ischemia, and if there was any relationship at all to her history of bariatric surgery. That's what we want to get to, essentially.
From the autopsy report, on the toxicology, there are 3 medications that she was positive. Oxycodone would be one. Buprenorphine, is it? That's for That's for obesity, I believe, weight loss. Or
that's one of the medications that is given to people who have long-term chronic pain, and that's one of the ways to tackle it, essentially.
And so maybe also related to depression.
Possibly.
And then the third one is quetiapine. That's also narcotic. So there are 3 narcotics was in her blood. So we don't know whether or not they were actually given. Well, I'm sure she had a prescription, but when you have that much money and big name, you are able to get those, just like the way that her ex-husband, Michael Jackson, was able to get Like
Mm-hmm. Mm-hmm.
they were able to get those things at their home. So this was, we are kind of, looking at it not just from what's really happened, but also what are the other contributing factors at the time of her death. One other thing that Dr. Irgau, if I may, before we go into too much of the clinical side of it,
Mm-hmm.
well, you and I, we didn't discuss this, so I want to actually point out one thing, and I just find this interesting. So the pain started in the morning, and her husband, she did tell her husband, I guess, her husband left
Ex-husband.
her ex-husband. She, well, because he was there, so I'm thinking that they were maybe
Right.
So he left with the kids to drop them off to school. So I don't have kids. You do, and you did a lot of schooling. What time the school starts?
So it should be, early, essentially. You probably are leaving the house by 7:30, I guess, for most people, right? Depending on how far it is from their house to the school, right?
Even if it's 8:30. So they didn't get to until 11:21. So minimum 3-hour delay there just to get to the hospital. So that's one thing that I wanted to actually mention. So that's the admission time. So
right. So to clarify that, Dr. Kemal, essentially, when the ex-husband got home from dropping the kids to school, he found her down, right? And then he called 911. 911 actually, the emergency services got to the place within 10 minutes after that call, right? So he got home, probably we have to assume around 11 o'clock, maybe a little bit before 11 o'clock, right?
Maybe he
found her down. They estimated that the downtime, meaning that the time in which she was actually down on the floor, might have been maybe 10 to 15 minutes, right? So we have the morning, right? Let's say 7 a.m., 8 a.m., whatnot. She was complaining of abdominal pain at that time, right? That is written in that report, based obviously on the witnesses that the police had talked to, right? Which included people in her household. Now, so she's complaining of abdominal pain at that time. Now her ex-husband leaves, right? He goes to drop the kids. He comes back maybe 2 to 3 hours later, depending on what time he left, based on what you were saying to school. And then he finds her down, right? Now, between when he left, when she was having abdominal pain, until he came back maybe about 15, 20 minutes before he got back, which is maybe 2 to 3 hours, she was still awake, but still having the pain, right? So the question would be, she didn't call an ambulance, she didn't call the hospital, she didn't call for help at that time. So what was happening at that time? And then, of course, one of the things that you could think of is that because she did have pain medication available to her, remember one of the things that they mentioned is she did have plastic surgery not too long before this episode, and she was taking pain medication. Maybe she was taking the pain medication to try to ease the pain that she was having, right? And that was maybe one way for her to take care of it. But obviously this was a severe condition, right? And so when he returned, she was on the floor, she was unconscious, not only unconscious, but apparently there was no heartbeat, right? And he started CPR. Her ex-husband actually, the report says, started CPR at that time, right? As he was waiting for the emergency services to appear. And then obviously once the emergency services appeared, they continued with the advanced type of CPR, and they were able to restart her heartbeat, and then was taken to the hospital with a heartbeat. But then in the hospital again, her heartbeat stopped, and they resuscitated her again. They were able to do many type of maneuvers, including put a pacemaker at that time to support her heart, but also to do an X-ray. They were able to do a CAT scan, which showed that there was distension of her intestine at that time. And then, of course, after that, her heart stopped again and they continued resuscitation, but then they were not getting anywhere. And they did do a CAT scan of the head as well, Kemal, which did demonstrate that she had something called anoxic brain injury, which means that her brain did not have oxygen for quite some time. So maybe during the downtime, her heart already had stopped and she was not getting oxygen. So potentially, irreversible brain damage may have occurred already at the time in which she was in our house, Kemal. That's one of the suspicions that you could have, essentially.